Hey, we are going to be doing a video today for hip strengthening and hip pain. So if you have weak hips or if you have pain in your hips, this could really help. All you'll need is your mat, and then I also have this playground ball. If you don't have one of these, no problem. Just grab a pillow and have it close. Okay, so we're gonna start on our backs. So find yourself in a comfortable spot with your legs hip distance apart, feet flat. We're gonna start with pelvic tilts. So take an inhale. And on an exhale, you're gonna curl your tailbone so it tucks towards you slightly, your low back flattens. And then you're gonna inhale, take it the opposite way and arch. So your low back gets this space and your tail tilts away from you. So an exhale curls your tailbone. It's like your pelvis is a bowl of water and you're tipping it towards you so the water spills onto your belly button. And then you tip it away from you so that the water spills over your pubic bone. So this is actually a really small motion. I don't want you moving your chest at all or tightening your neck or moving your knees. It just happens from about maybe like mid-spine, right above your belly button, down to your pubic bone. This is important because the hip socket itself is an attachment from your leg bone, your femur, into your acetabulum, which is a part of your pelvis. So it's actually fairly impossible to completely isolate the leg bone from the pelvis. The hip joint is a part of all of it. So whenever I treat the hips in my patients and I address hip strengthening, I'm always going to incorporate the glute muscles and the pelvis and the low back with all of it. So with gluteus medius, that's your hip abductors, your hip adductors. And then we're always going to get a little bit of core too, because that's going to help stabilize this whole area. So that's what you're going to get today, some of all of it. Okay, so now on this one, what I want you to do is curl your tailbone like you just did, and then continue to roll all the way up into a bridge. Inhale at the top. Exhale, starting from the top, soften your sternum, soften your ribs. You're really trying to roll one vertebrae at a time. Okay, inhale at the bottom. Exhale, tailbone curls first, so you flatten your low back, then you flatten each vertebrae before you lift it up, like a strand of pearls lifting. And then think about the hips staying level, so one hip isn't dropping more than the other. Do one more for me. Good. And then once you get to the bottom, you're going to grab that ball or the pillow. If you have a pillow, fold it in half and put it in between your knees. The ball is going to go right in between your knees too. All right, so now we're going to stay here. Take an inhale again. Exhale, I just want you to squeeze the ball. You're going to squeeze it 50% effort, okay? So not as hard as you possibly can, 50% effort, and then release. Exhale, squeeze, and as you squeeze, I want you to think about trying to pull your belly button towards your spine. Just really gentle, right? Again, you're not flattening your back at all. You're not letting anything move except the legs and the ball squeezing. We're waking up the inner thighs here. Okay, last one. And now we're going to add on to this. So now on your inhale, release the squeeze. Exhale, curl again, roll yourself up into your bridge, and now stay in your bridge. Squeeze the ball just with the right knee. Okay, so just the right knee is going to squeeze in, out. 3, 2, 1. Left leg, 5, 4, 3, 2, 1. Both legs, 5, 4, 3, 2, 1. Inhale, exhale, curl and roll down. Nice job. We're going to do that again. We're going to roll back up. Inhale, exhale, curl, roll up. Okay, now when you get to the top, this is a little more advanced, so if it's too much, just go back to what we were doing before. You're going to exhale, straighten the right leg out. Inhale, bring it back. Exhale, left leg. So you're trying to keep your hips lifted and level. That's the goal, okay? Is not letting one hip drop more than the other and trying to keep them both up. Okay, last one. Inhale, exhale, curl, roll yourself back down. Nice job. You can take that ball out, place it to the side. Now, find that belly button pulling in gently again. I want you to lift the right leg up. This is called tabletop. Now lift the left leg up. Then right leg comes back down. Then left leg down. Okay, right up. Slower is the name of the game here. And then right and left. So if you're wondering what in the world this has to do with your hips, it is really focusing on lower abdominal strength and stability. Huge when it comes to your hip function. It's a piece that's sometimes left out. So if I just made you go do 100 squats and lunges to get your hips stronger, it would probably just make your issue worse. And there's nothing wrong with squats and lunges, they're great. But what we need to do when there's an issue or a dysfunction or pain, we need to peel back the layers and get back to the basics and re-stabilize everything. Low abs, low back, all the small hip muscles. Okay, now start with the left leg. Left leg up, then right leg up, left down, right down. So that once those things are strong again, once the foundation is built again and the hips are healthy, then you can go do your squats and your lunges and all that fun stuff that you want to do. I think they're great. There's nothing wrong with them. But I would do you a disservice if I had you start there without first making sure that everything else is strong and ready to stabilize those hips. So hopefully that makes sense. But basically it's a very long way of saying, yes, do these that seem simple first, then get to the harder ones. Okay, last one. Nice job. All right, let's hug both knees in. Keep the right leg, straighten the left one out. Hold behind the right knee. Exhale, let's straighten the leg up. Inhale, bend. If you need to, you can just hold lower on the leg, especially if you have tight hamstrings. Okay, straighten it up. Stay there. Bring your arms down. I want you to draw little circles with that leg, about the size of a dinner plate. Your goal is to point the toes and keep that thigh strong and your knee straight. So if you're doing it right here, if it looks like this, then I want you to bring it lower until you can straighten it. It's much more important to me for this to keep it completely straight. Make that quad work. Okay, now reverse directions. Try to keep the hips steady also. See if you can keep yourself from rolling and rocking around. Nice job. Hug the knee in. Left hand on the knee, right arm out to a T, and you're going to twist. So bring the knee to the left, you're going to look to the right. And then let's slowly bring it back up. And we're going to switch legs. So hug the left knee in. Hold behind the leg. Exhale, straighten. Inhale, bend. One leg might be different than the other, so don't be surprised if it is. Okay, straighten it up, stay there, and let's do our circles. Again, bring the leg lower if you need to. But the goal is to keep that knee straight. Really strong quad. And reverse. Last one. Good. Right hand on the knee. Take the knee to the right. You're going to look to the left. And back to center. And let's straighten both legs out. Arms are going to reach behind you. Inhale. Exhale. Bring your arms out. Tuck your chin. And you're going to roll up one vertebrae at a time. If this isn't happening, that's okay. Just roll to the side and sit up. So you're going to reach. And restack. Tall, 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 tall. Inhale. Exhale. Reach, reach, reach. Restack. Last one. Reach. And now you're going to grab whatever you can your toes, your calves, your knees, maybe the bottom of your feet. And breathe. And then restack. Nice job. All right, so as always, you can find the full-length video over at jessicavalantpilates.com, and I hope that helps. Talk to you soon.